So welcome guys. In today's session, we are going to look at the river. And under the river today, we will look at the histology of the river. Just the histology, the gross anatomy. I hope I will do a video maybe. But you should look, it is also important. So let's start. Welcome all, my name is Oris Monyeri and I'm the Ure Daktari. So the histology of the river. Now, let's say something about the river. It is the largest internal gland of the body. You know, the largest gland in the body is the skin. So it is the largest internal gland of the body, weighing about 1.5 kgs. It is a modified exocrine gland with many other functions. Okay. Now, how is it organized? It is first supplied by the hepatic artery, a branch from the common hepatic artery from the celiac trunk, and also by the portal vein, which is formed by the confluence of splenic vein and the superior mesenteric vein, which drain most part of the gut. And it is also, the river is drained by the hepatic veins into the inferior vena cava. Now, bile is usually carried by bile canaliculi to the extrahepatic biliary tree or the biliary apparatus. Now, the river anatomically is divided into right, left, and the quadrate lobes. And the functional segmentation, the river segments usually correspond to the blood supply and bile drainage. And that functional segmentation is important surgically and clinically. Okay. I hope you have done the lobes of the river and gross anatomy. So, structural organization of the river. It has the following functional components. It has a capsule and the connective tissue stroma, then the parenchyma, which are the river cells. Then we have sinusoids and other blood vessels. We have the perisinusoidal space of D cell. We have the bile canaliculi. So let's start with the capsule. So the river is enclosed by the connective tissue capsule, known as the Grisson's capsule, named after Francis Grisson, who was a British physician and also an anatomist. So the capsule usually send in like a septa. Okay. So the connective tissue extended to the parenchyma of the river along with the branches of portal vein, also hepatic artery and bile canaliculi. So then we have reticular fibers, the collagen type 3, which form a network, a reticulum, that is in the river to support the parenchyma. These reticular fibers are agentophilic. They are silver staining. So under silver stain, they look black. So in this diagram here, you can see these black fine fibers here. These are your reticular fibers, the collagen type 3, and they form a reticulum that supports the river parenchyma. So let's look at the hepatocytes, the river parenchyma. Now, hepatocytes are large polygonal cells, and they usually show an open-faced nucleus with two or more nucleoli. Okay, they are nucleoli. You can see like here, you can see this has two nucleoli here. Why? Because remember, nucleoli is the site for synthesis of the ribosomes, and these cells, the hepatocytes they are metabolically active. They synthesize proteins such as albumin. Okay, the plasma proteins are synthesized here, so they must be metabolically active. They must have many ribosomes for that. So also these hepatocytes, their lifespan is 5 months, and they have a high regenerative capacity. That is why it is even possible to do a liver transplant twice, because once you slice the liver, it can regrow. Okay, that is the interesting thing about the liver. It can regrow. And like other parts of the body, which they say a finger, if your finger is cut, it can't regrow. But if you slice the liver, it will regrow. So their cytoplasm is eosinophilic. It takes up eosin stain. Okay. So surfaces of the liver cells. Now, the liver cells have three surfaces, namely sinusoidal surface, canalicular surface, and intercellular surface. Now, the sinusoidal surface is a surface that faces adjoining sinusoids. Okay. This surface of the hepatocyte usually show microvilli that project into the perisinusoidal space of Dc, and the function of the microvilli is to increase surface area of the cells for transport of nutrients across hepatocytes. Now, this is the sinusoidal surface here. This is the perisinusoidal space of Dc. This is a sinusoid, and this in blue here are your endothelial cells. Okay, so this is the sinusoidal surface. Then we have canalicular surface that forms the wall of bile canaliculus, okay, along with the adjacent hepatocytes. Bile canaliculi are separated from the remaining intercellular spaces by tight junction. So this is the canalicular surface here. You can see it is forming the wall of the bile canaliculus here. So to prevent leakage of bile, we have these are tight junction here to prevent the leakage of bile into the rest of the liver, which can be very bad. Then you have intercellular surface that usually face toward adjacent hepatocyte like this over here. Just this is an intercellular surface. Okay. So we have blood vessels of the liver. As I had said earlier, it has dual blood supply. That is from the hepatic portal vein, 75%, and the hepatic artery. Now, portal veins carry the nutrients and toxic materials absorbed from the intestine and the spleen and the pancreas. Okay. Remember, portal vein, as I had said, is formed by the union of splenic vein and superior mesenteric vein. Also remember, the inferior mesenteric vein drains into the splenic vein. Okay. So, blood from the parts drained by those veins must go through the liver. Okay. Then the liver produces bile that is drained by the bile canaliculi, hepatic ducts, and finally enter the extrahepatic biliary apparatus. Now, what is a portal triad? In the liver, a branch of hepatic artery, portal vein, and a bile ductule run together in form of a portal triad. Triad means 3 in 3. So in that portal triad, there will be a branch of the hepatic artery, there will be also a branch from the portal vein, and a bile ductule. So central vein, please remember this, central vein or hepatic vein do not form part of the portal triad. Okay, the central vein does not form part of the portal triad. Please remember that. But a branch from the hepatic and also hepatic vein do not form portal triad. It is the hepatic artery and the portal vein, not the hepatic vein. So the blood from the portal vein and hepatic artery enter into the hepatic sinusoid. So there is mixing of arterial and venous blood, the sinusoids. Then hepatic sinusoids drain into the central vein, then into sublobular vein, then to hepatic vein, and then finally into the inferior vena cava. Note, hepatic veins are valvulus. So this is how blood flows from the portal vein and also from the hepatic artery. It mixes in the liver sinusoids, then to the central vein, then to the sublobular veins, then to the hepatic vein, then into the inferior vena cava, then back to the heart. Okay, so you have the concept of liver lobules. This is important. Now, the structural organization of the liver forms liver lobules. Now, for descriptive purposes, researchers have described 3 different forms of liver lobules, as these are the liver lobules: classical hepatic lobule, or the classical lobule. Then we have the portal lobule, and we have the liver acinus, or the hepatic acinus, or the acinus of Rappaport. Okay, so classic liver lobule. It is a hexagonal mass with a central vein in the center and is surrounded by radiating anastomosis plates or cords of hepatocytes. Adjacent plates of hepatocytes are separated by sinusoids. Now, between adjacent classic lobules, a small quantity of connective tissue with portal triad is present. Okay, I will show you this in a diagram. Then at the angle of the hexagon, portotriads run in portocanals, the connective tissue area. Now, what is space of Moore? It is the space between the connective tissue stroma of portocanal and outermost hepatocytes. It is also called as the periportal space of Moore, and it is the site for lymph formation in the liver. Okay, let me do that in a diagram. Now, here you can see, these. They are somewhat hexagonal. Okay, you have to believe they're somewhat hexagonal. Then you can see at the angles we have like this is a portotriad here. This is the central vein. Then these are the radiating plates, radiating and anastomosing plates of hepatocytes, and in between them we have the sinusoids. Then if we take a diagram of the portotriad and magnify it, you will see here a bile duct, a hepatic artery, and a portal vein. Then this area is known as this connective tissue is known as the portal canal. Then the connective tissue that is here and between the connective tissue which is here and in between here and the outermost hepatocytes is known as the periportal space of Moore, and it is the site for lymph formation. So, Photorobio. Now, it is a triangular area of the liver parenchyma around each portotriad. It is considered as the functional lobule as bile duct lies at the center. It is the functional lobule, okay? Central veins lie at the corners of the lobule, okay? So, this photorobio refers to the area of the liver that is supplied by one portal vein. So you can see this portal vein here will send will supply blood to the sinusoids that will be drained by this central vein, also by this central vein, and also this central vein. It is triangular with the portotriad at the center, 3 central veins at the 3 corners. That is the portal lobule, and it is the functional lobule. Okay. Then we have the hepatic sinus of Rappaport. Please remember this. Let me go back that the portal lobule is the functional lobule. Okay. But the functional unit, the structural and functional unit of the liver is the hepatic sinus of Rappaport. Please remember that. And it has 2 axes, a short axis and a long axis. This is the short axis and this is the long axis. Short axis is the one that lies between the 2 closest portotriads, okay, here and here. Then long axis lies between the 2 closest central veins. Then it has 3 zones. Remember, the hepatic sinus also refers to the area of the liver that is supplied by a single hepatic arteriole. Okay, the hepatic arteriole here will run along here. It will run from this portotriad here to this portotriad. They will anastomose. Then they will send branches to that area. So the hepatic sinus refers to the area of the liver supplied by a single hepatic arteriole, and it is the function and structural unit of the liver. So it has 3 zones. Zone 1 lies near to the portotriads here. It receives more oxygenated blood, okay? It is the one which is very close to the hepatic arteriole, so it will receive more oxygenated blood, but it is the one which is exposed to more toxins. Zone 2 lies here, between zone 1 and zone 3. Then zone 3 is the one which lies farthest to the hepatic arteriole, but near to the central vein. It will receive less oxygenated blood, but it is the one less prone to toxins present in blood, but it is more prone to hypoxic injuries. Okay, it may suffer the consequences of low oxygen concentration. Then let's look at the liver sinusoids. Now, The cords of hepatocytes are separated by the hepatic sinusoids, which are lined by discontinuous endothelium with the which has discontinuous basal lamina, and also they are lined by the sterate sinusoidal macrophages, the Kupffer cells. Now we have what is known as the perisinusoidal space of Dicem. Now, sinusoidal epithelium is separated from the underlying hepatocytes by just a small extracellular space called the space of Dicem. Now, into which the microvilli of hepatocytes project into. Now, there is no significant barrier between blood and hepatocytes. You can't say there is a blood hepatocyte barrier, like the way there is a blood-brain barrier. There is no blood hepatocyte barrier. Why? Because there are large gaps between adjacent endothelium cells. Remember, those are sinusoids. So the endothelial cells are, they have gaps. And also the endothelium, the basal lamina of endothelium is discontinuous. Also, and please remember this point, the space of this is a site for hematopoiesis in fetal life, okay? Then we have another cell type known as the hepatic sterate cells of Ito, which lie in the perisinusoidal space of this. What is its function? Storage of vitamin A and lipids. But in liver disease, they usually undergo fibrosis, okay? And they are usually converted into myofibroblasts, leading to liver fibrosis, okay? So the hepatic cells of Ito undergo fibrosis and they form to become myofibroblasts, leading to liver fibrosis. So here we are. You can see here the central vein. Okay, then you can see here is a sinusoid. Like here, this is this is a portal triad. You can see the portal vein. You can see the hepatic artery. Then you can see here the bile duct. You can note that the bile duct, it is lined by a simple cuboidal epithelium. These cells lining the bile duct are known as the cholangiocytes. Then you can see here the hepatic sinusoids. Now, between the hepatic sinusoid and the hepatocytes, there is a perisinusoidal space of Dicem. Here you can see how blood flows. Blood from the portal venule and the hepatic arteriole will enter into the hepatic sinusoid, then be drained into the central vein. Okay, then you can see bile, it is flowing in the opposite direction. Then here you can see the space of mole, the periportal space of mole within the portal canal. Now let's look at the intrahepatic biliary tree. Now, intrahepatic biliary tree usually drain the exocrine part of the liver, that is the secreted bile, and conveys it to the extrahepatic biliary tree through the right and the left hepatic ducts. Now, intrahepatic biliary tree consists of the following: bile canaliculi, which are formed between adjacent surface of hepatocytes. Then we have the intralobular or the intrahepatic ductus, or also known as the canals of Herring. Now, bile canaliculi drains into the canals of Herring or the intralobular ductus, which are lined by simple cuboidal epithelium. They are named after Carl Edward Constantine Herring. Now, then this intralobular will drain into the interlobular ducts, okay? Then, which are lined by simple cuboidal to columnar epithelium and form part of the portal triad. Then, several interlobular ducts drain into the right and the left hepatic ducts, okay? Which now will combine the right and the left hepatic ducts fuse to form the common hepatic duct. Then via the cystic duct, it will drain bile into the gallbladder. Now, note that bile flows centripetally opposite to the flow of blood in the sinusoids. Then also bile flows away from the central vein toward the portal triad. Now, then we have special bile channels known as the duct of Ruschka, or the accessory bile duct, which is a small bile duct that drains either into the bile duct directly or into the right hepatic duct. And usually it usually lies between the inferior surface of the liver and the superior surface of the gallbladder. Named after Hubert von Ruschka, who was a German anatomist. So this is how bile flows from the hepatocyte. They produce bile, then into the bile canaliculi, then into the intralobular ductus, or the canals of Herring, then into the inter. This should be inter, not intra. Interlobular ducts, which are form part of the portal triad, then into the right and the left hepatic ducts, then to the common hepatic duct. Then here you have the cell types, the location and the major function of some cell types in the liver. Have the hepatocytes, which are found in the cords and or plates. Then you have the Kupffer cells, which lie in the sinusoids. Then you have the hepatic cells of Ito, found in the perisinusoidal space of Disa. You can see their function. Then we have the sinusoidal endothelial cells lying in the sinusoids. Then we have the hematopoietic cells, which are found in the perisinusoidal space of Disa. You can see their functions here. You can pause the video if you like to and note them. Then here we have a summary. Let's look at this summary. Let me move this. The liver lobules, there are 3 types: classical, portal, and the liver sinus, or the hepatic sinus of the purple, which is the classical lobules shape hexagonal. At the center, you have the central vein. Then portal lobule, it is triangular. At the center is the portal triad. Liver sinus, or the hepatic sinus of the purple, which is the structural and functional unit of the liver. They are elliptical in shape, and they have 3 zones. Then the liver summary, it has a stroma, the connective tissue, and the Brisson's capsule. Then the parenchyma, the classic hepatic lobules, which are hexagonal in shape with the central vein at the center, cords of hepatocytes radiating from the central vein. Then the portal triad. At the portal triad, we have a branch of the portal vein, hepatic artery, and the interlobular bile duct. Then the liver sinusoids, which are lined by the discontinuous endothelial cells, Kupffer cells, and the basal lamina of the is also discontinuous. So this is just a summary of what we have been doing in the last say 20 minutes, and you can pause the video and look at this. Okay, just this is a summary. I won't look at it, but you can pause the video and look at it. So thank you for your attention, guys. We have come to the end of this session, and please subscribe for more anatomy and biochemistry content. Thank you.